40 millimole per kg body weight. 35 to 40 millimole per day. Is it clear? That means production of bases are almost half than that of the acid. Okay, if production of the base is 100 millimole per kg body weight, production of bases will be 50 or 45 millimole per day. Okay, per day. That means 1 millimole per kg body weight acid is produced, and about 0.5 millimole per kg body weight bases are produced. So more acids are produced than bases. More acids are produced than bases, and that requires as more acids are produced, and this acid production is also variable. For that reason, body may be assaulted by this increased acid loads. To prevent this assault by the acids, there is body defenses. Body defense that may include body defenses against acids, body buffer system, that means buffer system, respiratory system, renal system. Three systems are present: buffer system, respiratory system, renal system. Buffer system act instantaneously, that means within seconds. It may neutralize acids or bases. Okay, respiratory system, that is it eliminates volatile acids, and renal system eliminates non-volatile acids. Is it clear? The renal respiratory system, it takes a longer time, about hours, and renal system takes also a longer time, and it persists more than the buffer system. Okay, body buffer system buffers resist and minimize change of pH. Weak acids of buffer pair are sources of the protons and conjugate bases. Buffers actually supply conjugate base or protons. Conjugate base is supplied when there is more acid is produced, and conjugate protons are supplied more when there is more base in the body. Okay, so these weak acids in fact are reservoirs of base or protons. They act within seconds. The buffers act in cooperation with respiratory and renal systems. The limitation of the buffer system is, though it resists change of pH, as per definition, it cannot eliminate acid or bases from the body. That is the limitation of the buffers. It resists change of pH and minimize change of pH, but it cannot eliminate acids or bases. For elimination of acids or bases, the respiratory system and kidney system is required. Respiratory system eliminate volatile acids, and kidney can eliminate non-volatile acids and bases. Okay. Respiratory system. Respiratory center sensitive to changes in pH. sensitive changes in proton. That means hydrogen ion concentration. Okay. It is the vital route for elimination of volatile acids. It has been mentioned. It acts within minutes. It acts within minutes, and metabolic acid-base disorders are usually compensated by respiratory system. That is important to learn. Okay, then.
Assalamu alaikum, sir.
Alaikum assalam. Yes.
A few students are waiting to join the class.
Okay. I'm trying to include him or her. Okay. A lot. What to do? সজাল আসেন ওদিকে এরা এত দেরিতে আসায় বিরক্ত এখানে এরা ইয়ে হচ্ছে চাচ্ছে এরা এদেরকে ইনক্লুড করতে হবে তো এখানে এইখানেই করতে হবে এরা ঢুকতে পারে না এখানে না এখানে ঢোকার জন্য এইখানে এটা জানেন না তাহলে আনমুট ইয়া করছেন না স্যার এটা তো আসছে না ওখানে ওইটা তো ওই যে অপশনটা আসছে না এখানে অ্যাডমিটটা এখানে আসছে না এখন অ্যাডমিট অল দিয়েছিলেন তো প্রথম স্যার দিয়েছিলাম এটা দেওয়ার পরে শুরু করেছি তারপরে এরা দেরিতে আসছে এখন এটা কিভাবে ওই মেয়েটাকে ডাকেন দেখি ওকে ডাকেন আনমুট করে দিলেই হয় ওই আনমুট করে দিলে হবে ওকে ডাকেন আন্দাজে আচ্ছা রানাল সিস্টেম হ্যাঁ হ্যালো হ্যাঁ আচ্ছা এরা ঢুকতে চাচ্ছে কিভাবে হবে দেখান দেখি এতগুলা এখানে পরে আসছে অ্যাডমিট কোথায় আসছে না তো অপশন হ্যাঁ
সেটা তো অলরেডি অ্যাডমিটেড আছে
না যারা আছে ঢুকছে
স্যার এরকম তো কোনো লিস্ট এখানে নেই
আচ্ছা কিছুক্ষণ আগে বললো তো একটা মেয়ে যে ঢুকতে যাচ্ছে
স্যার আমি দেখতে পাচ্ছি সবাই অলরেডি অ্যাডমিটেড আছে এখানে কারো রিকোয়েস্ট নেই
আচ্ছা ঠিক আছে হ্যাঁ তাহলে এটা আমার রিকো হচ্ছে এই যে
স্যার এটা আমার জন্য হচ্ছে স্যার
তাই এই যে এখানে দেখেন এই যে কতগুলা
না স্যার এগুলো তো হচ্ছে কি অলরেডি কানেক্টেড আছে
কানেক্টেড আছে
জি স্যার এখানে কারো রিকোয়েস্ট নেই স্যার
ওটা অপশনটা অ্যাডমিট অপশন আসছে না
এখানে অটোই তো ওদের নাম চলে আসবে স্যার
ঠিক আছে হ্যাঁ আচ্ছা ঠিক আছে হ্যাঁ রেনাল সিস্টেম ওটা আবার ওই হচ্ছে রিকো হচ্ছে না দিন ঠিক করে দেন renal system eliminate non-volatile acids we mentioned the another function is recovery of bicarbonates that means bicarbonate reclamation so two functions it eliminate non-volatile acids that means those protons also recover bicarbonates and also generate new bicarbonates. There is three functions: elimination of protons, then recovery of bicarbonates, then generation of bicarbonates. This is the functions of the renal system in acid-base balance. Okay, eliminate acids by binding with phosphate and ammonia buffers. Okay. If somebody enters late, this is the problem. Okay, do you follow, students? Echo, please echo. Is it comprehensible to you?
Yes, sir.
Okay. Acid-base, the simple acid-base disorders, complex acid-base disorders. The simple acid-base disorders include acidosis, alkalosis. Acidosis includes metabolic acidosis, respiratory acidosis. Alkalosis includes metabolic alkalosis and respiratory alkalosis. Now come to the point, complex acid-base disorders. Any combination of primary acid-base disorder excepting respiratory acidosis and respiratory alkalosis. Okay, there's any combination of primary acid-base disorders, but respiratory acidosis and respiratory alkalosis is not. Respiratory acidosis, respiratory alkalosis cannot occur because a person cannot hyperventilate or hypoventilate at the same time. You test on yourself. You cannot when you are holding the breath and when you are eliminating your breath, it is these two is not possible same time. Okay, next point, you see, in acid-base disorders, these parameters are pH, pK, base, and acid. Okay, pH, pK, and base, acid. This base, acid, and also pH, these are variable. And but pK, this is constant. This is constant. Suppose pK of bicarbonate vapor, this is 6.1, and it will remain 6.1 all the time. And here for bicarbonate vapor we have shown. Is it clear? Here pK value has not been put. It is 6.1, and this bicarbonate. Why we choose bicarbonate? Because bicarbonate vapor is responsible for about 65% of the total buffering capacity. That's why bicarbonate vapor. By assessing the bicarbonate, we can assess acidosis, alkalosis. Okay. Next, primary defects of acid-base disorders. In metabolic acidosis, whatever may be the metabolic or respiratory acidosis, if it is acidosis, the pH is lowered. We know. What is its definition of acidosis? pH less than 7.35. pH less than 7.35 is called acidosis. Okay. So metabolic acidosis or respiratory acidosis, whatever may be the event, in both pH decreases. pH decreases to what extent? Decreases from normal value. Normal value of pH, what is? Normal value of pH is 7 point, normal range 7.35 to 7.4, 7.45. Okay, this is the range. And average pH average, this is also important, 7.40. This is the average body pH in a healthy person. And so you naturally understand, if the pH decreases from the 7.4, then that means it is approaching towards acidity. And if it is increasing more than 7.40, that means it is approaching towards alkalosis. In metabolic acidosis, you note pH decrease of pH is due to decrease of bicarbonate, due to decrease of bicarbonate concentration. This third bracket indicate concentration. Okay, and so metabolic acidosis is characterized by decreased bicarbonate concentration. This is the primary defect of metabolic acidosis, decrease of bicarbonate. Okay, respiratory acidosis, this is also acidosis, pH is decreased, but this decrease of pH is due to decrease of carbon dioxide, increase of carbon dioxide. Respiratory acidosis, pH decreased due to increase of carbon dioxide tension. Is it clear? So decrease of pH can occur in two ways, either by decrease of the bicarbonate or by increase of carbon dioxide tension. This is regarding, so the primary defect of respiratory acidosis is decreased carbon dioxide tension, decreased carbon dioxide tension. Then let us move for, let us metabolic alkalosis, respiratory alkalosis. That means alkalosis. In alkalosis, alkalosis is characterized by increased pH, and pH is increased more than 7.45. 7.45. pK here is constant, but this increase in pH can, okay, আস্তে কথা বলো ওখানে, শামসু তোমার গলা শোনা যায়. Increase of pH is due to increase of bicarbonate, due to increase of bicarbonate. Is it clear? This is nominator. This bicarbonate is the nominator, and this carbon dioxide tension, that is it is the denominator. Here nominator decreases, denominator remains unchanged. Okay, in that case, what could happen? pH will rise. pH will rise due to increased bicarbonate, because the denominator is increased. And in respiratory, so metabolic alkalosis is characterized by increased bicarbonate concentration. Okay, primary defect of metabolic alkalosis is increased bicarbonate concentration. Respiratory alkalosis, here pH is increased. This decrease of pH, this decrease of pH, this decrease, this increase of pH, respiratory alkalosis, this increase of pH is due to decrease of carbon dioxide tension, decrease of carbon dioxide tension. The primary defect of respiratory alkalosis is decreased carbon dioxide tension, decreased carbon dioxide tension. Okay, so by this time, and next, and the complex acid base disorder. Complex acid base disorder. In complex acid base disorder, what happens? Any combination of primary acid base disorder excepting respiratory acidosis and respiratory alkalosis. Okay, parameters for assessing acid base disorders. In acid base disorders, we assess the following parameters. Number one, pH. pH can be measured by pH meter. Hydrogen ion concentration, bicarbonate concentration, carbon dioxide tension, potassium concentration, compensatory, by observing the compensatory mechanisms, anion gap, and identification of the underlying cause. Is it clear? These are the parameters to be measured in acid base disorders. Okay, then come to the point, some important causes of metabolic acidosis. Metabolic acidosis is causes of metabolic acidosis can be discussed in two broad headings. Number one, high anion gap metabolic acidosis, and number two, normal anion gap metabolic acidosis. In high anion, causes of high anion gap metabolic acidosis include lactic acidosis, ketoacidosis, and the most important ketoacidosis is diabetic ketoacidosis that occurs in uncontrolled and prolonged starvation, uncontrolled and prolonged diabetes mellitus, also in starvation. That can happen renal failure, in renal failure and poisoning, okay. The difference between lactic acidosis and ketoacidosis with renal failure is that in lactic acidosis and ketoacidosis, acid production is more, and in renal failure, elimination of acid is defective. That means less acids are eliminated. That's why acids accumulate. Acids accumulate in our body in renal failure. Okay. Normal anion gap remains normal here. The anion gap, normal anion gap, metabolic acidosis is diarrhea, renal tubular acidosis, renal RTA, renal tubular acidosis. Okay, diarrhea, renal tubular acidosis. Here, the anion gap remains normal, and lactic acidosis, ketoacidosis, renal failure, the anion gap increased. Next. It may happen that time spent, in that case, I will be increasing the time. Okay, I will be there will be re-entry. If I find the number of students remains same, we will be continuing. If decreased, it will be postponed. Okay. Compensation and correction of metabolic acidosis. Compensation and correction. Compensation means restoration of the ratio of the acid base. Restoration, the acid base, the ratio of base to acid is 20:1 in case of bicarbonate. Is it, if bicarbonate we consider the ratio of base to acid is 20:1. And restoration of the ratio is called compensation. Correction means restoration of concentration of both this base, is it carbon dioxide tension. Is it clear? Next. So in compensation, what happens? You see, if it is compensation to take place, the primary defect of metabolic acidosis is decreased bicarbonate concentration. This is primary defect. Primary defect is decreased bicarbonate concentration. So the ratio can be restored by decreasing the carbon dioxide tension, and as it happens here, is it clear? So if the bicarbonate is also, if the carbon dioxide tension is also decreased, as well as this this bicarbonate, then the ratio will be restored. Okay, is it clear? Suppose in bicarbonate, this if the ratio is if the ratio is decreased, and the ratio is decreased, say the figure, if the figure is 10 is to 1. Is it clear? In that case, if the carbon dioxide tension is decreased to half, then ratio will be restored 10 is to half. That means 20 is to 1. It becomes, if this is decreased, says this is decreased to 10. If carbon dioxide tension is also decreased, say from 1 to half, that means restoration of the ratio. That means 20 is to 1 is restored. This is compensation. And correction if this bicarbonate is increased by some way, by the kidney through the recovery, generation of the bicarbonate. Is it clear? And this is also changed to normal. In that case, there will be the restoration of the concentration of both bicarbonate and carbon dioxide. Okay. From compensation, if when compensation is immediately required because body cannot tolerate acidosis or alkalosis, so first compensation is the first preference, followed by correction. Renal compensation and correction, how it can happen? Excretion of protons, recovery of the bicarbonates, generation of the bicarbonate, synthesis and secretion of ammonia. These are the ways by which renal compensation and correction can occur. Metabolic acid-base disorder are usually compensated by the respiratory system, and respiratory acid-base disorders by the renal system. Renal system play vital role for correction of metabolic acid-base disorders. Okay, we finish this chapter. Now come to the point, respiratory acidosis. Primary defect of respiratory acidosis is increased partial pressure of carbon dioxide. This carbon dioxide tension is increased. That's why pH is decreased. And causes include bronchopneumonia, pneumothorax, few causes, pulmonary fibrosis, laryngeal edema. This is an acute case, laryngeal edema, chronic obstructive lung disease, okay, depression of the respiratory center. And these are the probable causes of respiratory acidosis. In respiratory acidosis, carbon dioxide tension is increased, and that ultimately leads to decrease in pH. So biochemical findings in respiratory acidosis, if it is uncompensated, there will be disproportionate increase of carbon dioxide tension and bicarbonate. Okay, ratio of base and carbon dioxide tension is decreased, but proportionately this disproportionate means this increase, the more increase of the carbon dioxide tension, and there also there can also increase of some increase of this bicarbonate. Okay, but this is disproportionate. Okay. Okay. Respiratory acidosis, we finished. Okay. When it is compensated, that means this is proportionate. That means this is proportionate. Okay. The ratio of base and carbon dioxide tension normal and pH normal. But if it is uncompensated, the ratio of base and this bicarbonate can be decreased. Is it clear? And pH is decreased. Okay, decrease of pH is mainly due to decrease of carbon dioxide tension. The decrease of carbon dioxide tension. Concentration and ratio and pH return to concentration and ratio and pH return to normal. And when there is correction, okay, urinary findings, titrable acidity, increased excretion of the ammonium chloride. Okay, this is renal compensation. This is renal compensation. Okay, next. Compensation correction of respiratory acidosis. Role of buffers. First, buffers act instantaneously and these buffers resist change of pH. Then renal compensation comes into play. How renal compensation? There will be, as there is acidosis, as elimination of acids will be, there will be increased elimination of the protons. There will be a recovery of the bicarbonate and generation of the bicarbonate and synthesis and secretion of the ammonia that will ultimately compensate the